Hello everyone, my name is Donna Price and I will present to you the annual Compliance Officer Update. Moral Rights to Healthcare. HCA 322, Healthcare Medical Law and Ethics, Instructor Jeff Kingsbury. October the 12th, 2017. The topic for the day is Healthcare Laws, Ethics, Medical Malpractice, and Cultural Competency. Why are laws used? Laws are used to protect patients and their rights. Laws are used for patient privacy and confidentiality. Laws are used for patient safety, and laws are used to reduce and stop medical errors. There are different types of laws. I'm going to be talking to you about 4 laws today, and the first law is going to be the Patient Bills of Rights. The Patient's Bills of Rights was first adopted by the American Hospital Association in 1973. The patient has the right to considerate and respectful care. The patient has the right and is encouraged to obtain from physicians and other direct caregivers relevant, current, and understandable information about his or her diagnosis, treatment, and prognosis. The patient has the right to know the identity of physicians, nurses, and others involved in his or her care, as well as when those involved are students, residents, or other trainees. The patient also has the right to know the immediate and long-term financial significance of treatment. The patient has the right to make decisions about the plan of care before and during the course of treatment and to refuse a recommended treatment or plan of care if it is permitted by law and hospital policy. The patient also has the right to be informed of the medical consequences of this action. In case of such refusal, the patient is still entitled to appropriate care and services that the hospital provides or to be transferred to another hospital. The hospital should notify patient of any policy at the other hospital that might affect patient choice. The patient has the right to privacy. Case discussion, consultation, examination, and treatment should be conducted to protect each patient's privacy. The patient has the right to expect reasonable continuity of care and to be informed by physicians and other caregivers of available and realistic patient care options when hospital care is no longer appropriate. The next law I'm going to talk about is HIPAA. HIPAA is called Health Insurance Portability and Accountability Act. And it is actually a United States legislation that provides data privacy and security provisions for safeguarding medical information. The Health Insurance Portability and Accountability Act of 1996 required the Secretary of the U.S. Department of Health and Human Services to develop regulations protecting the privacy and security of certain health information. Today, providers are using clinical applications such as computerized physician order entry systems, electronic health records, radiology, pharmacy, and laboratory systems. Health plans are providing access to claims and care management, as well as member self-service applications. While this means that the medical workforce can be more mobile and efficient, physicians can check patient records and test results from wherever they are, and the rise in the adoption rate of these technologies increase the potential security risk. A major goal of the security rule is to protect the privacy of individuals' health information while allowing covered entities to adopt new technologies to improve the quality and efficiency of patient care. The security rule applies to health plans, healthcare clearinghouses, and to any healthcare provider who transmits health information in electronic form in connection with a transaction for which the Secretary of HHS has adopted standards under HIPAA and to their business associates. The next law I'm going to talk about is genetic information discrimination. Title II of the Genetic Information Non-Discrimination Act of 2008, which is called GINA. It prohibits genetic information discrimination in employment, took effect on November 21, 2009. The EEOC enforces Title II of GINA. The Departments of Labor, Health and Human Services, and the Treasury have responsibility for issuing regulations for Title I of GINA, which addresses the use of genetic information in health insurance. Genetic information includes information about an individual's genetic test and the genetic test of an individual's family members, as well as information about the manifestation of a disease or disorder in an individual's family member's family history. Covered entities must keep genetic information confidential and in a separate medical file. Genetic information may be kept in the same file as other medical information in compliance with the Americans with Disabilities Act. Family medical history is included in the definition of genetic information because it is often used to determine whether someone has an increased risk of getting a disease, disorder, or condition in the future. The next topic we're going to talk about is Code of Ethics. Code of Ethics is pretty much healthcare professionals following rules and guidelines, and they should always be doing the right thing. They should be given good performance and showing responsibility. Healthcare professionals should be given principles of respect and informed consent to the patient. Healthcare quality professionals are defined by a standard of conduct deep-rooted in commitment, confidentiality, and relationships. Healthcare quality professionals' primary commitment is to the health, well-being, and safety of patients. Healthcare quality professionals promote the dignity of the profession and are committed to practicing with honesty, integrity, and accountability, respecting all laws, and refusing to participate in or conceal any unethical, false, fraudulent, or deceptive activity. Healthcare quality professionals' primary commitment is to the health, well-being, and safety of patients. They must take appropriate actions which are consistent with organization policy regarding any instances of incompetent, unethical, illegal, or impaired practice. Healthcare quality professionals promote the right of privacy for all individuals and protect the maintenance of confidential information to the fullest extent permitted by law. Healthcare professionals should maintain membership in professional organizations as a means of promoting quality and professional growth and avoid the use of such a membership for the sole purpose of solicitation of business or for personal financial gain. So the next topic is going to be about cultural competency, which means that you should have patient advocacy first, putting the patient first, having self-awareness, acceptance of patients with different values, being compassionate and sensitive, and most importantly, getting cultural training. Culture is a person's learned beliefs, thoughts, and behaviors, their values, customs, and traditions, their communication style, their views on relationships, and the different ways they interact with others. Culture is shaped by many things, including race, ethnicity, nationality, heritage, socio-economic status, education, and other factors. Cultural competence is the ability of healthcare providers and organizations to meet the cultural social needs of their patients. Cultural competence is so important for the effective delivery of quality health care. Lack of cultural competence can lead to poor patient satisfaction and outcomes, and frustration for both patients and healthcare workers. Ways that healthcare facilities can attain cultural competence is through in-house training and education videos for nurses, doctors, and other healthcare workers. making sure that all patients are treated with equal respect and dignity. Poor communication between healthcare workers and patients can lead to great health disparities and lower levels of satisfaction with healthcare. When patients feel heard and understood by their healthcare providers, they are more likely to participate in preventive healthcare and less likely to miss appointments. When healthcare workers at all levels of care are given the tools and training they need to become culturally competent, improved patient satisfaction and outcomes are the inevitable results. The goal of cultural competence is to create a healthcare system and workforce that are capable of delivering the highest quality care to every patient regardless of race, ethnicity, culture, or language proficiency. The last topic we want to talk about is medical malpractice. We're going to be talking about the violation of the standard of care, injury by negligence, misreading or ignoring laboratory results, inappropriate patient history, improper medication or dosage. These are some things that can cause medical malpractice. Medical malpractice occurs when a hospital, doctor, or other healthcare professional, through a negligent act or omission, causes an injury to a patient. The negligence might be the result of errors in diagnosis, treatment, aftercare, or health management. Okay, let's talk about the violation of the standard of care. So this is like the law acknowledges that there are certain medical standards that are recognized by the profession as being acceptable medical treatment by reasonably prudent healthcare professionals under like or similar circumstances. An injury was caused by the negligence. So for a medical malpractice claim to be valid, it is not sufficient that a healthcare professional simply violated the standard of care. The patient must also prove he or she sustained an injury that would not have occurred in the absence of negligence. An unfavorable outcome by itself is not malpractice. The patient must prove that the negligence caused the injury. If there is an injury without negligence, or negligence that did not cause an injury, there is no case. Some other examples of medical negligence would be failure to diagnose or misdiagnose, unnecessary surgery, surgical errors or wrong site surgery, poor follow-up or aftercare, premature discharge, failure to order proper testing, and failure to recognize symptoms. Patients trust their providers to perform their duties with care and with high expectations, especially if they are having surgery. If someone experienced medical malpractice, they should contact a lawyer. In conclusion, morals in healthcare should be practiced by all healthcare professionals with willingness to stand up for and act on one's ethical beliefs. Moral courage is doing one's role of duty to bring good consequences. All healthcare organizations and professionals have a responsibility to uphold ethical standards. Thank you.